Welcome to the complete guide to nosebleeds, from emergency to prevention. Oh boy, nosebleeds. They're bloody, messy, and they're just downright annoying, especially if they keep on happening. But look, they don't have to derail your day. I'm Dr. Merchant, and as a family medicine physician who's treated thousands of nosebleeds, I'm giving you the complete no BS guide to handling them like a pro. So in the next few minutes, I'm going to cover everything you need to know. From how to stop a nosebleed fast, preventing them before they start, the crucial 24 hours after a bleed, and what actually works, Vaseline or Neosporin, and lastly, when you need to get medical help immediately. No fluff, no filler, just practical advice that works in real life, not just in textbooks. Let's dive in. Today, I'm going to teach you how to stop nosebleeds fast. First, you're going to tilt your head back just like this. Nope. Just kidding. That's usually the first mistake. Let's go over the proper technique and how to stop this thing the right way. First, you want to lean slightly forward. This prevents you from swallowing blood, which can make you nauseated. Next, you want to pinch the soft part of your nose firmly, not the bridge, but here, right where it's squishy. Next, after that, you want to hold for a full 10 minutes. Most people release too soon, so set a timer on your phone. And while pinching, breathe through your mouth and stay calm. And last but not least, you want to apply a cold compress to your nose and cheeks to constrict those blood vessels. And then after 10 minutes, you can release pressure slowly. But when should you get help? Well, if it bleeds for over 30 minutes, or if the bleeding is excessively heavy, or you've had a recent head injury, or you're on blood thinners. Save this video, you'll thank me later. Let's talk about preventing nosebleeds. Parents, kids, I know you guys are tired of those surprise nosebleeds. So let's stop them before they start. The secret? Moisture. Insight number 1. Dry nose passages cause most nosebleeds. Your location matters. Southwest USA has very dry air, so you'll see constant nasal dryness and frequent bleeds. What about northern India? Dusty, polluted areas, and what you'll see are irritated, inflamed nasal passages. How about cold places? Russia and Canada. These places tend to have harsh winters with a lot of indoor heating. You'll see a lot of severely dried mucous membranes as a result. Last but not least, Florida. Humid, but full of allergens. So what you'll see? Inflamed and vulnerable nasal blood vessels. Insight number 2. Kids with allergies get more nosebleeds because itchy nose rubbing, drying allergy medicines, inflamed nose lining, and forceful sneezing. That's all it takes to put some pressure on some tiny blood vessels in your nose to cause it to bleed. Not to mention, sneezes come out at like 100 miles per hour. So any wound healing that has occurred, it's now gone. Insight number 3. 3 simple fixes. Saline nose spray 2 to 3 times daily. You can use bedroom humidifiers at night and petroleum jelly / Vaseline or Neosporin. And you're going to apply that just inside the nostril entrance. All right, just right here. Little bit on the pinky and just go right inside, right down the nasal septum. So, little tip for you. Apply Neosporin first for healing, then petroleum jelly for longer protection to seal that skin, especially if you're using both. These steps can reduce nosebleeds by up to 80%. Follow for more medical tips that actually work. Let's talk about post-nosebleed care, the 24-hour healing plan. So, did you just have a nosebleed? Here is your 24-hour plan to prevent it from coming back. Number 1, treat your healing nose like it's made out of tissue paper. Basically, guys, be gentle. You want to blot, but don't blow if a sneeze is coming. So remember, blot, but don't blow if you feel that sneeze coming. Please redirect it through your mouth or something, okay? But look, I can't redirect it through my mouth very well, but some people can, so I recommend you take your allergy medication so you don't sneeze to begin with. All right? Number 2, keep it calm. Skip the gym, hot showers, alcohol, and spicy foods. Your heart and your blood vessels need to chill. Those vessels need to constrict, not dilate, because dilation equals bleeding, and that's not what we want. Step number 3, use gravity to your advantage. Look, you want to sleep with your head propped up at night to reduce pressure on those healing vessels. So add an extra pillow if you need to. Don't worry. All right? It's going to help you. Number 4, moisture is your friend. Drink plenty of water. all right? You can even run a cool mist humidifier or use gentle saline spray for those battered nasal passages. Either way, you need to get that area more moist. Number 5, skip blood thinning meds like aspirin and ibuprofen for 24 hours. Because listen, your blood needs to clot. It doesn't need to flow. So when should you get help? Pretty simple. If bleeding doesn't stop with pressure after 10 to 15 minutes, then it's probably time for some professional backup. Look, just one day of this plan, it will dramatically reduce your chance of another nosebleed. Vaseline versus Neosporin. What actually works for nosebleeds? Let's settle this debate once and for all. So for prevention, drum roll, Vaseline wins, hands down. Why? It creates a moisture barrier, which is exactly what you need. And you can apply it exactly where you need it. So I got the best schnoz to demonstrate this, so pay attention. You want to put this on the nasal septum, which is that middle portion that divides right and left. So take your little Q-tip, put your Vaseline, put it right there in the front. You see that? Right there in the front. Okay? That's ground zero for 90% of your nosebleeds. Now, Neosporin. Basically, I want you to skip this if it's for routine use. All right? So again, not for routine use. Why? Because it has antibiotics and your nose just doesn't need it in that moment. It can also irritate any sensitive nasal tissue. And you know, if you don't need antibiotics and you're using them all the time, you could develop an antibiotic resistance. So when does Neosporin actually help? Really, it's only for healing cuts, persistent crusting, or after a doctor-treated bleed. Pro tip though, for post-nosebleed recovery, use both strategically. You can apply a thin layer of Neosporin first, then Vaseline over the top. One heals and one protects. But which one should I use daily? What is my best daily option? Well, you probably guessed it. It's petroleum jelly / Vaseline. Or you can use saline gel. Both are effective moisture controls without any antibiotic concerns. All right? So, nosebleed prevention doesn't need to be complicated. Save this to end all confusion for nosebleeds. When to seek medical help for nosebleeds. Most nosebleeds are harmless, but knowing when to get help can save lives. Here are key warning signs that mean you should seek medical attention. Warning sign number 1, bleeding that continues after applying proper pressure. What's proper pressure? 10 to 20 minutes of pinching this little soft part right here, not the hard part, okay? The little soft part. Why does it matter? Because prolonged bleeding suggests either a larger vessel or some sort of clotting issue. Warning sign number 2, heavy bleeding that interferes with breathing or causes you to swallow blood. This means even when you're leaning forward, you're bleeding so much that you're still swallowing it, which means there's a large amount of it there. Why does this matter? Well, because this volume of blood loss can lead to dangerous complications and can indicate something more severe. Warning sign number 3, nosebleeds after a head injury. This could signal a skull fracture or brain injury requiring immediate evaluation. Those are serious. Warning sign number 4, bleeding while on blood thinners like warfarin or even daily aspirin. Why? These medications can turn a minor bleed into a major one and need specialized treatment. Warning sign number 5, recurring nosebleeds multiple times weekly despite prevention efforts. Why? Well, this pattern suggests an underlying issue that simply needs to be diagnosed. Now, there are some additional red flags. One-sided bleeding, right here or right here, with headaches could indicate a possible growth. Also, first-time nosebleeds in patients after the age of 60. This may indicate a higher risk of arterial bleeding. Or bleeding with unexplained bruising could indicate some sort of possible blood disorder. Also, for those with high blood pressure, your nosebleeds might be harder to control and signal the need for better blood pressure management. Remember, while 95% of nosebleeds are harmless, these warning signs help identify the 5% that need medical attention. This information can make all the difference when it matters most. Dr. Merchant out.